This patient presented with the series of ill-fitting crown and bridge work which needed to be removed, reprepped, and reimpressed. Considering the amount of inflammation in the gingival tissues, taking an adequate impression will be a challenge. When troughing with the diode laser in lieu of packing cord, there are three important things to keep in mind. Number one, use short overlapping strokes, maybe 2 millimeters, and overlap. This allows the laser energy to adequately infuse into the tissue and remove tissue without actually doing a surgical type procedure. Secondly, don't go too deep. What we want to do is go only 1 millimeter to 1.5 millimeters into the sulcus depth. If we go too deep, the tissue may end up collapsing upon itself, covering the margins which we were trying to expose in the first place. And the third tip is if you overheat the tissue to the point that it becomes blanched or white, know that this tissue will no longer be there when the patient returns to insert their restoration. You've overheated the tissue and it needs to be removed at this appointment immediately. When troughed properly, using the proper protocols, the tissue will remain exactly where you left it at this stage of treatment.